Good morning, and my name is Ralf Friedrichs. I'm an addiction recovery coach, a life coach, and your host of this show, the Take Your Life Back Today show. Folks, the opiate abuse on the workplace is on an all-time high. The opiate abuse in the world is on an all-time high. The first time you saw one of your workers appear to nod off during a staff meeting, you pulled him aside, you pulled her aside after the meeting. When you asked if they were okay, they said they were. You gave them the benefit of the doubt because they've been working for you for, maybe a couple of years or so. Then it happens again. You pull them aside again. You say to yourself, well, I know that they've been going through a divorce, or they've been going through some struggles in life, so I want to give them the benefit. So you pull them aside, and you ask them again, and they reveal that they've been trying to get off painkillers, that their doctor had prescribed painkillers, whether it was for a sickness and an injury, or maybe they're on some sort of medication for depression, and they have become addicted to it. These are the people that are excellent employees. They're great at what they do, but they're showing signs of opiate abuse taking over their lives. It could be you. It could be a judge. It could be a doctor. It could be anyone. Opiate abuse can affect anyone. Your turn could be next. Even if the problem hasn't hit you yet, my friends, it still may be. According to the Center of Disease Control Prevention, as of 2015, nearly 2 million Americans abuse prescription drugs. Even your best managers, even your best employees are at risk. Anyone is at risk. The more professional stature you have, the less likely you're going to be forced into recovery. And the longer your addiction is likely to go unchecked, my friends, it could show up at a Xerox, or at a presentation, or even on the food line, if that's what your job is. I mean, fully out of it. I don't know how many times that I've seen that people were fully out of it during their working environment. They just zoned out, passed out, went to sleep. Good old Bill was doing a presentation one day, standing there with his little remote control, about 1/3 through, and things just went bad. He passed out. He just collapsed. This presentation had some big shot executives, and they were all wondering what was going on with Bill. Bill had an opiate abuse problem. Head off problems before they even begin. Prescription drug abuse sneaks up on those who ordinarily would never think of abusing drugs. People like you and me. After all, doctors prescribe painkillers to soften the edges of post-surgery or injury and pain. And to those who are battling chronic pain, who seek to avoid surgical intervention, some employees use a few painkillers as possible. Educate your managers, educate your supervisors. Managers and supervisors need to understand that potential signals of opiate abuse and learn how to what to say if they have concerns with one of their employees. While managers and supervisors can't expect it to informally diagnose the problem, they need to know how to refer the employee to alcohol and drug testing. Those same managers, those same supervisors also need to be watched. You, as the owner, need to be watched by yourself. Opiate abuse at the workplace is on an all-time high. We need to make everyone aware that works in our facility, your facility, that drug testing is a necessary thing. Keep your workplace safe. If you suspect an employee has a problem, you can arrange for testing. Despite our country's opiate epidemic, according to the testing firm Quest Diagnostic, only 13% of our roughly 6.5 million workplace drug tests include screening for prescription painkillers. We need to be alert. We need to be on the watch out. Create a solid workplace drug policy. Your policy needs to outline the circumstances under which a manager might have a reasonable suspicion concerning an employee's potential drug abuse and the procedures to follow to have the employee tested. If your company's drug testing policy predates December 2016, it may contradict occupational safety and health administration requirements, otherwise known as OSHA. We need to pay attention to each other, not just to, if you're a manager or executive, to people below you. You need to pay attention to yourself. You need to pay attention to everyone. Because at work, opiate abuse is on the rise. In this country as a whole, opiate abuse is on the rise. Now listen to this little story. First time you saw Bill appear to nod off during a staff meeting, you pulled him aside, this executive said after the meeting. When he asked if he was okay, he said he was. Bill said, "I am okay." You gave him the benefit of the doubt because he'd worked for you for 3 years and has been a good employee all along. You knew he'd been recently gone through a divorce and thought maybe he had a hard time sleeping due to personal problems. Then Bill blew up at a customer. When you brought him in a second time, he told you he'd been trying to get off prescription drugs, prescription painkillers he'd been using for back pain. Welcome to the opiate epidemic. It just found its way into your workplace, and something sometimes has to be done. Because my friend, Bill's supervisor, if you're out there watching me, this could have been you. Could have been me. Even if the problem hasn't hit you yet, it's still me. It is affected yearly by 2 million Americans. Even your best managers and employees are at risk. Even the judges, the police, even the president, anyone is at risk for opiate abuse. Head off the problems before they begin. Start today. Prescription drug abuse sneaks up to those who ordinarily would never think about abusing drugs. It just comes right through the back door. You need to educate yourself. You need to educate your managers, your supervisors. Educate your employees. Managers and supervisors need to understand the potential signals of opiate abuse and learn what to say if they have concerns. Drug testing is a mandatory at any workplace. And it's not just for the people that are below supervisors. It's for anyone, including the executives. Keep your workplace safe. If you suspect an employee or an executive, you can arrange for testing immediately. Despite our country's opiate epidemic, according to the testing firm Quest Diagnostics, only 13% of the roughly 6.5 million workplace drug tests include screening for prescription painkillers. We need to include the screening for painkillers in a higher volume, because drug testing will pick up on hardcore drugs as crack, coke, marijuana, alcohol. We need to include prescription drug abuse into the pre-screening of drug testing. We need to create a solid work drug policy. Your policy needs to outline the circumstances under which a manager might have reasonable suspicion concerning an employee's possible drug abuse. And please go according to or adhere to the policies and the procedures of OSHA. If your company's drug testing predates December 26, 2016, it may contradict the Occupational Safety and Health Administration requirements, and you need to do something today. Folks, pay attention to your co-workers around. More importantly, pay attention to yourself, because drug abuse, painkiller abuse, opiate abuse is on the rise, and for a lot of people it's an easy way out of facing reality and facing their weaknesses, but it's going to kill many thousands of people. Start today, October 14, 2017, to put your foot down in your own life to avoid having any opiate abuse, but also be careful about the people you work with. If you're in the executive branch of your company or in management, pay attention to your co-workers, pay attention to yourselves, pay attention to the people above you, because opiate abuse is everywhere. No one is excluded from it. It is up to all of us to prevent abuse of it. I hope to God, folks, you both, everyone out there has the best day of their lives. Call me at 844-405-HELP, because together, you and I, we can help each other take our lives back. Please remember, through the power of prayer, even opiate abuse can be eliminated, because God will not allow you to put anything into the body He has created unless you are going to force it into you. But through the power of prayer and through the help of Christ, Christ will help you, prevent you from ever doing that again. And may God bless you this beautiful Saturday morning at 5 o'clock, October 14th, 2017. And may God bless you. Take care.